Tilak's in the house here. Dr. Tilak, we kind of got cut off on the last show when we were talking about sugar. I think it came up about, I think we, one of the instigating factors is Mayor Bloomberg is trying to outlaw sugary drinks of over a certain size. And you, to some extent, agree with that effort for a number of reasons, and which we'll get to. But it hasn't died down, especially in social media. It seems to be like a sugar war going on right now.
Absolutely. I think that's a good change. I think people need to talk about it, and we need to be open about it. There were very important points that were made last time by the callers, and I really appreciate it. One of them was somebody said that you cannot legalize or litigate human behavior, but the way I look at it from how I handle my patients and the struggles they go through is we should not have the rights to promote such bad behavior, eating behaviors that leads to such a loss of quality of life. So it comes down to the sugar war again. A 12-ounce can of pop has 10 teaspoons of sugar. Do your math. The ideal amount of sugar that is recommended in a day is 9 teaspoons for a whole day. If just a 12-ounce of pop has 10 teaspoons of sugar, which is over your limit, why do we need the rest of those sizes?
One can of pop is 10
teaspoons of sugar.
Is that just like 7-Up, or is it
any pop is sugar? I'm not talking about diet pop. So the calorific drinks, 12 ounces, has 10 teaspoons of sugar.
What about diet pop?
Diet pop has no calorific sugar. Those are sugar substitutes, which is another totally different discussion. And what is very interesting is that I was quickly reviewing the data that we have on sugar consumption in the United States. And what was interesting is that if you look at just sugar consumption, there was actually a fall between the 1980s to 1990s to the 2000s. And the reason there was a fall is they're talking about the natural sugar that you get from sugar cane and sugar beets. But the real calorific sugar that increased in consumption were the refined sugars in the United States, which is even worse. And when I say refined sugars, they are the high fructose corn syrup.
219-845-1100. Let's go to Lee on line 1. Lee, what do you think?
Doctor, you mentioned some of these sugar substitutes. I've heard it said that, the manufacturers, because of the price of sugar, a lot of them have gone to high fructose corn syrup as a replacement for sugar. And I've heard it said that the body does not know how to metabolize that. And it just turns right into fat, more so than the sugar would even. Have you heard that? And what do you think about high fructose corn syrup?
The correct science of it is that high fructose corn syrup has very similar composition of simple sugars that a sugar has. So they are two monosaccharides put together. So the metabolism in the body will be about the same, but the problem is that high fructose corn syrup is much, much less expensive than natural sugar. And so there is overutilization of this in the food industry, resulting in overconsumption. So if you look at the molecular basis, they're very similar.
So it's just the same as you're saying, but it's just that, they probably put it in everything. It's just
exactly
just as bad as sugar then.
Absolutely, yes.
So why is it that important to go against sugar? I mean, how does it rip your body up?
See, that is the million-dollar question, and I hope that everybody has a chance to listen to this segment. Sugar and carbohydrates are the only food exchanges that create an insulin response. Insulin, in my opinion, is the bad word in your body. What insulin does is it converts the glucose into fat. Insulin is also a growth factor. The other name for growth hormone is insulin-like growth factor. So insulin basically makes things grow. So we believe that it is indirectly related to the high risk for cancers in the obese individuals, high risk for cardiovascular disease, because atherosclerosis is also growth of certain cells and fat in the endothelial or the inner lining of the blood vessels. So high insulin state is what is the nightmare behind all of this. And what is it?
High insulin state.
Yes, we call it hyperinsulinemia. Excess amounts of insulin in your body.
And that comes from taking in too much sugar.
And when you become insulin resistant, that means when you have excess body fat is very resistant to insulin action. The action of insulin is to take the blood glucose and internalize it. So it controls blood sugar. But if your insulin is resistant, what happens is for the same amount of carbohydrate load, that person who's insulin resistant makes a lot more insulin. So that you have excess amount of insulin in response to the same amount of carbohydrate between a lean individual and an obese individual. Natural sugar is good as long as we don't portion distort it. And that's all we are talking about. We do not have to avoid sugar completely, but we need to keep it within a limit. Now, what happens is when you portion distort real sugar is that it creates an addictive pattern in you. And the reason is the insulin response, because the excess amount of carbohydrates drives your insulin levels so high that an hour or two after that load, your sugars drop. You didn't feel the high, you will feel the drops. So you feel very tired, you are angry, irritable, and the only way you can sustain life and pull yourself back up is to take the sugar load again. So you have created in your own body a vicious addictive cycle. And that is the problem of the oversized sugar drinks, oversized starchy foods.
All right. Hello, doctor.
Hello.
Yes, I have a question. When a person's blood sugar is high, can that, you said when their blood sugar is low, it can make them irritable. Can it also make them irritable when their blood sugar is pretty high?
It depends upon how high. When it goes to in the 300s, 400s, you're going to develop dehydration. And based upon other comorbid illnesses that you have, you can also have more electrolyte abnormalities. So it can cause some mental status changes, and you may not be responding appropriately to the external stimuli. Yes, you could.
Okay, but it would have to be like in the 300s.
Pretty high blood sugars.
Okay, like not in 200s at all.
Less likely. There may be other reasons why somebody could be irritable then.
Who's in the 300? Someone you know or yourself?
Well, just a general question.
And it's more for several days your blood sugars are that uncontrolled, and sugar causes diuresis. That means it makes you urinate a lot, and you would know that when your blood sugars are poorly controlled, you make a lot of urine. And that's called osmotic diuresis. And when that happens, you also lose potassium and other electrolytes along with it. That causes quite a dysregulated metabolic status in the body. So you never know how you feel at that point.
Okay. And also, does having diabetes, does that cause a person to crave sweets?
You know, the reason why a diabetic craves sweets is the same thing that I'm talking about, that when you have a sugar intake or a carbohydrate intake, it causes a high insulin response. And in a diabetic, the insulin response is even higher because we are insulin resistant at that state. So insulin does drop the blood sugars. So that hour or two later, your blood sugars drop. And that is the reason you crave for sugars, because that's the only substance that can bring you back to normal blood glucose.
Okay.
There's a lot in there, isn't there, Mary?
There is.
Hey,
what about when, like, I know that a lot of times you hear that it affects your feet, and a lot of people have to have their feet amputated.
It's a very good point. I think we need to take this a little further in our discussion. So what are the effects of diabetes on the body is what we are talking about.
But what about when somebody starts getting like little blisters on their toes? Is
Yes.
that an effect from diabetes?
all right, thanks a lot, Mary. We appreciate it. Answer that, would you please?
Yes. So the first question was about peripheral vascular disease, and that is a very important complication of diabetes. So diabetes affects the large blood vessels in the body and the small blood vessels in the body. So diabetes is a disease of blood vessels. It's not just a disease of blood sugar. Blood sugar is just the tip of the iceberg. And that's just a thing that you're able to see very quickly, and so you see, and you're able to monitor it. That's all you know about. But underneath of it, it is affecting all your blood vessels. So macrovascular disease, or the large blood vessels, are the vessels in your legs, so peripheral vascular disease, circulation to your brain, So that is the risk of stroke and circulation to your heart, and that is the coronary artery disease or heart attack risk. So these are the big blood vessels. The small blood vessels are what you have in your eyes, so that diabetes causes blindness because of the blood vessel disease in the eyes. Kidneys, it causes kidney failure because of that. And neuropathy is a disease of the small blood vessels that supply blood to the nerves. So that's how neuropathy comes on with diabetes. So when you develop neuropathy, you don't feel your feet. So you could have trauma to your feet and not realize it. We have had patients who come with a nail stuck into their foot and they did not even know it because they are that numb. And now you also have a circulation problem. That means you're not going to heal that area. And then it leads to open ulcers. And if you don't take care of it, amputation can result. But we have very good vascular techniques available these days that we're able to go and open up. If somebody has missed the initial stages and have not done correct primary prevention, we're talking here about secondary prevention. We've already allowed these end stage, end organ damages to occur, but still we have room to treat it. We could do certain vascular techniques that can open circulation.
Dude, you have a nail in your foot.
Yes. Check it out. I'm sure there would be some listeners who know somebody who has had that happen.